Health officials continue to investigate the state's first possible case of serious lung injury related to e-cigarette use. The patient on the Big Island, who's under the age of 18, is in the hospital. The state health department has sent a medical advisory to all doctors statewide, urging them to be on alert for signs of severe respiratory illness among patients who use vaping products. Data from 2017 shows 26% of Hawaii high school students currently smoke e-cigs, which is twice the national average. Well, now we're taking a closer look at the dangers and symptoms of vaping and the symptoms that you should watch out for. Joining us now with that is Dr. Tucken Loh with the Pulmonary Medicine Department of Adventist Health Castle. Thank you for joining us again.
Good morning.
Good morning. Very important and very scary kind of topic. It's kind of growing all of a sudden. First of all, what are e-cigarettes? What's vaping all about?
Well, vaping is some new modern phenomenon where they actually have this little device with a battery that can heat up the liquid, what they call e-juice. And what that happens is the liquid actually become a vapor, and then the person inhale. They come in different form. They come in like vape pen. They come in a vaporizer, they come in mod, tanks, all these little devices, including hookah vape pens. Now, they also come in different flavor, sometimes sweet and so forth, and then they also come in different concentration of nicotine. And the unfortunate thing is we don't know exactly how much is there in that concentration in the nicotine.
But there is nicotine, because I think there's a myth out there that some people think that there's no nicotine involved.
Yeah, there's definitely nicotine, and the issue with the nicotine is that people that want to use this vaping device, they think that if you're a smoker, you can actually transition to that so that eventually you'll be able to stop smoking. We really don't know for sure whether that actually is true. There's no really long-term study that show that to be the case. People that have not started smoking, they start to use this as an alternative, especially with the younger population of teenagers. Now this has actually become what they call a vaping epidemic, you know, in this country. And the issue with the vaping epidemic in a teenager is that because they have the sweet, fruity flavor, and they think like, oh, it's probably not that harmless, and we can't be sure.
Right. Okay, because that was my next question, because a lot of people might wonder, okay, so maybe there is a little bit of nicotine. Is it maybe less harmful than cigarettes?
Well, the issue here is that because it's such a new phenomenon, we really don't have long-term study to actually show that. But I can tell you that personally, even though I didn't realize it about 2 years ago, I took care of a case, and I didn't think about it. But more recently, over the last 2 months, I've taken care of 3 cases already at Adventist Health Hospital. And all these people are very young people. They're like 18 to 24. One of them just got discharged a few days ago, 38 years old. But all these people should not have pneumonia. They presented themselves with pneumonia, with dry cough that is constant. They couldn't stop coughing. They have chest pain. They got shorter breath. And the thing is, many of these people should not have these symptoms. They ended up with pneumonia. We treated them like pneumonia, but it's not like pneumonia.
Okay, so doctor, I'm going to stop you right there, because this is a first possible lung-related case of vaping, but you're saying that you may have treated 3 others recently that may have been linked, or that presented themselves as pneumonia, and then later on you kind of discovered that it was lung-related to vaping.
So the first case I took care of was actually 2 years ago, and I didn't put the 2 and 2 together. I know that that individual had vaping. I didn't kind of associate that. But what was so interesting is that kind of died off, and then a couple months ago, I started to have these new cases that are young people. That just got me thinking to ask them about vaping history, and that's what I started to have that. And as a matter of fact, I actually have X-ray that shows you that when they come in, if you look on the left-hand side, that is what they consider a normal chest X-ray, where air is black. So if you look at the chest X-ray, which is the first one, I think we need to go back a little bit.
Okay.
The chest X-ray actually show air as being black, and the middle part is the heart. And if you look at the chest X-ray on the right-hand side, you can see all the white part that looks like pneumonia on the lower part of the chest X-ray.
So this is a before and after, but how much time has passed?
So this is actually occurring in just a few days. So in just a few days, the one on the left is actually a separate patient, a different patient for comparison. The patient that I have on the right is actually the one that I immediately saw. The follow-up CAT scan, which is actually the cut across, you can see subsequently in the following next 4 slides here, you're going to see the abnormal normal chest CT on the left, then the abnormal vapor injury progression as you keep going down through the slide here. You see all the white part, which is the abnormal part of the CAT scan.
So, doctor, you're saying after just a few days of vaping, you'll start seeing effects in the lungs and elsewhere.
That's correct. And actually, you know, nationwide, we have over 450 cases now that's been reported. We got over this in 33 different states actually have this condition reported. As of this morning, we actually have number 6 case that have died from this, and it's in Kansas. So the first case was actually reported in Illinois.
Can you talk more about the symptoms that people should watch out for? Because I know you said it kind of mimics pneumonia, but what do you want to tell the viewers about what they should be aware of and what they can do if they think they might be experiencing any kind of lung-related illness because of vaping or e-cigs?
So here it is. If you have been vaping and you start to have symptoms of coughing, like a dry cough that actually doesn't go away, and you didn't have any other problem in your lung that actually would present themselves with coughing that's unrelenting, chest pain, shortness of breath. You can also have symptoms like nausea, vomiting, and diarrhea, which is not even related to any kind of lung things. And then you can have fatigue, fever, and even people have been telling me about their losing weight. And these are like young, healthy, otherwise people that are losing weight from this. So we really don't know exactly what is it about the vaping process that actually caused these problems.
But you do know that it is harmful and it is causing people to die, and it is kind of becoming an epidemic in young people. So people really need to be aware. And also, it doesn't take years to develop. And in such a short amount of time, you can see the effects already.
You know, and that is the scary part about this whole thing. It's just so new, and we really don't know a lot of answers to this issue. All
right. Thank you so much, doctor, for being here. Very important topic.
Well, I want to make sure that you know that if you have any of these symptoms, to make sure that if you are vaping, go to the medical professional for help, making sure that you go to the emergency room to, you know, if you are on our side, you can come to our emergency room, and we will take care of you as well.
All right, thank you so much.